Health and city officials providing an update on COVID-19 in Springfield and Western Mass as a whole. And today, word that the number of cases in Springfield, as we said, now approaches 800. Western Mass News reporter Audrey Russo joins us live with the very latest. Audrey?
It's been exactly 3 months today that the first U.S. case of COVID-19 was confirmed within the country. Now, local health officials say they've got the virus well controlled in the hospital setting and say we now need to turn our focus to curbing community hotspots as a method of pandemic control.
So certainly things are stable, and possibly they may even be going down.
Local hospital officials explaining to Western Mass News and others in Springfield on Monday that COVID-related hospitalizations and critical care patients are stabilizing in Western Massachusetts, something they claim to be communicating with the state government.
To let them know that things are settling down here a little sooner than they are in the eastern part of the state.
Baystate Health CEO Mark Kerouac says virus hotspots in the local area have been from long-term care facilities, dense city neighborhoods where social distancing is harder to maintain, and among populations with pre-existing chronic conditions. Springfield Mayor Dominic Sarno announcing expanded testing efforts for one demographic in need.
We're going to start testing the homeless, I believe, is Wednesday. That's important.
Kerouac says it's not time to stop social distancing yet, but says because of the progress that's been made, Western Mass may be closer to the possibility of reopening than other parts of the state.
Based on what we're seeing here in terms of case load, we feel that we will soon be ready to take that first step.
Though the need for more COVID-19 testing was highlighted several times, so is the need for cooperation in contact tracing efforts. Springfield Health and Human Services Commissioner Helen Colton-Harris says many people have been willing to answer the phone calls, warning of possible virus exposure. But she says others are resistant.
You tell me you don't want to give those folks your information. You don't want to tell them who you have been in contact with. Many individuals look at this as almost like an STI or a sexually transmitted infection. It's not. This virus is nobody's fault.
Now, over the weekend in Springfield, there was a deadly shooting on College Street, and health officials and city officials took time out of this morning's press conference to address that, and they had a lot to say about how the pandemic has been affecting crime in the city. We'll have more on that coming up on Western Mass News at 6. In particular, one specific type of crime they say they're seeing spiking during these times. Live in Springfield, Audrey Russo for Western Mass News.